Hi everyone, my name is Marissa and I will be presenting my capstone project on limiting laboratory errors by implementing a laboratory information management system. To introduce the issues at hand, laboratory science is an important field for healthcare that can assist in diagnosis, routine testing, and follow-up testing. 80 to 90% of diagnoses are reached from the results of laboratory testing, which describes the need to have accurate laboratory testing. Errors in laboratory testing can occur in 0.012 to 0.6% of laboratory testing. While this is not a high percentage, one error can affect and delay the results of patient testing. The potential for an increase in cost and delay in results not only impacts the patient but also the laboratory. The aim for my project will be to reduce harm to patients by creating a laboratory information management system that limits laboratory errors. To provide some statistics that will further explain the problem, there are over 13 billion laboratory tests performed annually. These tests can be as simple as a CBC liver panel or as complex as many genetic testing. Due to incorrect or delayed medical diagnoses, someone in the United States dies every 9 minutes. Diagnostic errors affect 12 million adults annually. Lastly, 4 million adults in the United States are harmed each year from preventable diagnostic errors and contribute to 80,000 deaths annually. Real patient cases can provide a greater insight of how laboratory errors affect patients. So case number 1 shows how Michael Brown, 68 years of age, arrived to the ER for pain. Blood was collected and lost in transit, causing a delay in testing. A LIMS system would have tracked the sample for timely arrival. Patient number 2, Natalie Jones, 18 years of age, has routine blood work done, but had previously had blood work done 2 weeks ago that came back within range for all tests. Patient must now pay a duplicate for their testing. The LIMS system would have detected and recommended to not run this testing, reducing the cost to the patient and saving time for the laboratory. Finally, patient 3, Howard Smith, 76 years of age, had a bone marrow drawn for specialized oncology testing. Incorrect specimens tubes, so incorrect collection tubes were used. Testing is delayed and recollection must occur, causing harm to the patient and a delay in testing. The LIMS system would have provided accurate collection method, ensuring timely results. The solution to the laboratory errors will be to implement a laboratory information management system, also known as a LIMS. What is a LIMS? A LIMS is a central system to manage all laboratory tasks and functions that will help to eliminate errors within the laboratory. The system will be able to provide real-time tracking of samples, cost analysis, timeliness for testing, reporting assistance, and most importantly, error detection and elimination. With the LIMS, increased efficiency of testing functions can be seen as chain of command features are included within the system. Cost savings will also be seen as errors and retesting are reduced, which shortens the time for diagnosis and cost, not only for the patient and for the laboratory. The main functions of the LIMS system will include workflow management, so aiding the laboratory with the workflow, order management, they can assist with previous orders, ensuring the correct order is made, and ensuring no duplicate orders have been done, sample tracking, ensuring the samples actually arrive to the laboratory in a timely manner, inventory management, this can help the laboratories track their inventory, what lots are used, and which reagents are used for each individual testing, data storage, so any resulting data, any inventory data, patient data, all can be stored in it. Error detection and error elimination, this being the most important, it's going to be able to use artificial intelligence to track and detect the errors and hopefully in the future eliminate it. So all these functions are critical to have in one central system, allowing for ease of use for the laboratory. One of the innovative pillars that can be measured through the system implementation would be outcomes. The outcomes of the implementation will create a positive change in the cost of laboratory testing for the patient and the laboratory. Data should show a decrease in cost as retesting would not be necessary and accurate testing will be performed and resulted. The ease of use of the system can be measured by the users, which would create a positive change from the previous system in place. Value would be created that can be measured as economic growth for the company and as a plan for the company's future. Lastly, the reduction of errors would be a measurable outcome for the system. We should be able to see a decrease of errors the longer the system is in place, and also an elimination of those errors. The second innovative pillar is evidence-based practice, which can be used to determine other studies that have used a LIMS system and the positive effect on laboratory testing. Evidence-based practice can utilize evidence to make informed decisions about how to eliminate errors and create safer patient care. Evidence-based practice can assist to provide value to the patient and laboratory professionals through laboratory testing. In addition, we can also use the evidence-based practice to take current laboratories that are using systems to demonstrate what is wrong in those systems and fix those errors to ensure more adequate systems are used. Value is a critical aspect of healthcare. The system would allow for value to be created for the patient and the laboratory. Approximately $750 billion of annual healthcare spending is categorized as unnecessary, which can lead to errors and delayed patient results. Value creates safer laboratory testing for patients and a reduction of costs to the laboratory and patients. And finally, the implementation of the system and elimination of laboratory errors will provide accurate diagnosis for patients. Please see my attached references, and I look forward to any feedback. Thank you.